This is a video about gender confirming top surgery for our female to male patients and scarring. So a lot of guys are pretty scared of nasty, ugly looking scars, the scars can be quite long, sometimes all the way across the chest, with the masculoplasty technique or the double incision. So we do everything we can to try and optimize the closure at the time of surgery, but oftentimes the best predictor of how you're going to scar after your surgery is how you've scarred in the past. So first thing you want to do is look to see if you've had any other surgical incisions, and that might tip you off as to whether or not you're going to scar well. Unfortunately, the chest is one of those spots in the body that is prone to what we call hypertrophic scarring. So about 15% of patients will develop hypertrophic scarring, and these are raised and red initially and can be pretty thickened scars in the long run. So there's so much out there about how to prevent these, and unfortunately not a lot of it has any science behind it. So I'm going to tell you the 3 things I recommend to optimize your scar. So first thing, you got to protect your scar. So even though summer may be around the corner and you may be super excited to get your shirt off and show off your fabulous chest, you really have to protect it from the sun. So in the first year, we're very strict about this. This basically means during the days of any sort of strong sunlight between 9 and 5, keeping your shirt on. You could try very strong SPF, but really the official line is to protect that scar, keep it well out of the sun, at least for the first year. So that's number 1. Number 2 is scar massage. Now this we do know works. I see there are so many products out there, topical products or ointments, lotions, which unfortunately really don't have too much evidence behind them. So what I recommend is every day after your shower, just use a good moisturizer, so cocoa butter or whatever lotion you like to use, and do some scar massage as just part of your daily routine. So scar massage, we don't start that until 6 weeks after surgery, and this is because your wound will have the strength to be able to tolerate it by then. So scar massage helps break up the scar, and what you do is you put the lotion on, and basically you can rub it pretty aggressively. You don't want it to hurt, but you're not being too gentle either. And this we know does more than likely help the appearance of the scar. The last thing I recommend are silicone products. So these come in the form of sheets, which you put on for usually about 12 hours a day, or there are also silicone gels, which do have some evidence behind them, and we see these being somewhat effective in our burn patients. We're not 100% sure of the mechanism by which they work, but those are really the only products out there that have any sort of science behind them. Other than that, unfortunately, you may be wasting your money with other products. Some surgeons recommend not using the extremities, really limiting the range of motion in the shoulders for the first 6 months. I'm not entirely sure I buy that, and again, that's a really tall order for our patients. So those are my recommendations. To summarize again, top 3 recommendations to give you good scars: sunscreen number 1, and protecting those scars, just keeping them out of the sun for the first year. Number 2, scar massage, and number 3, silicone products. I hope this helps.